Hello, everyone, and welcome to a studio. Welcome, Michelle. How are you?
Thank you so much, Gila Jan.
It's been a while since you came to visit us.
Thank you for inviting us. Thank you.
And you always come in with such wonderful new things, or sometimes not necessarily new, but refreshing our memory with some things that's going on. So, Michelle, Wellspring Spa, can you tell us how can we make ourselves beautiful?
Well, there's so many ways.
Without operations, of course.
Of course. Right now, the non-surgical is more common than surgical.
Good.
And it's so much easier and so much less expensive to spend any money to...
Affordable. It's
very affordable. Very affordable. Okay. People would be surprised by the affordability of this.
So surprise us. Tell us.
For instance, we have treatments of radio frequency.
Radio frequency.
That's so good for tightening the skin and lifting and getting rid of this.
So how does that work? I'm sorry, but it's hard for me to imagine. How does it work?
It has actually, there's so many places that they offer this service right now. They have tips with very small needles, 1 millimeter or 1.5 millimeter, that goes into the dermis. And they hold it for like a few seconds, and it actually gives radio frequency into the dermis, immediately tighten up. And people who do this kind of treatment, there's two kinds. There's fractional RF microneedling, which is a much bigger machine. There's also RF with a handpiece that with the different lights that it's refreshing and building up the tissue. Actually, it builds up the dermis, extends the dermis.
What else do we have? Next.
We have microneedling, as I mentioned, and also there is a machine, it's called All-Therapy. It is ultrasound. Of course, that machine may be expensive. We are planning to buy it and to get it, but it's very expensive.
The only ultrasound I remember is when they put it over your stomach when you're having a baby.
No, this is a special type of ultrasound that makes a big difference for the dermis. It makes the dermis tighter.
Wow.
And also gets rid of the lines in the skin.
Okay.
So with they do one treatment, and after 3 months they do another treatment. And supposedly the effect lasts 2 to 5 years.
Wow.
As far as tightening is concerned.
Wow. So that's got to be a lot more expensive than $700 if it's going to last
I'm pretty sure it is.
For a few good years, I can imagine. Okay.
And there's also CO2 fractional that for people who have acne scars, people who have all kinds of sun damage, kinds of hyperpigmentation on their skin, and the skin looks dull. Doing one session of that and just a downtime of 4 or 5 days, it's a big difference in the skin of anybody I've ever seen. Also, there's some people think that permanent makeup is only to make people to have a big frame of permanent makeup in their eyebrow, which is very unrealistic and looks ridiculous because this is not how it should be. It should be something refined.
Who would and why would somebody put permanent makeup on their face?
For instance, permanent makeup. I have permanent makeup on my eyes.
Can see it.
And it is easy because I don't have to do it every day. Even if I wash my face, I look the same.
But what if you want to change? Like today, you want to put black eyeliner. Tomorrow, you want to put a green one.
You can put whatever you like on it, over it. It doesn't.
Okay.
It doesn't oblige you to use the same thing.
Does it fade?
Eyeliner doesn't. It takes 20 years.
Wow.
To wear off. But eyebrow is a very easy thing. You can do it semi-permanent once a year, or more permanent with a little bit darker, a few more sessions of touch-up. But some people who don't have any eyebrow, or
that I can understand.
The style of their eyebrow is totally gone, and there is no style, and they can't see especially older women that, they cannot see, they cannot be prepared to adjust their eyebrow every day or to do their eyeliner. It's a good idea to do it.
Do people do their lips too?
Yeah, some people do. Mostly
I heard about that.
injection of the lips
No,
inside the lips.
I heard about actually staining, like putting like permanent makeup on the
Yes,
lips.
we do. We do
like put it like little.
we do the full lips as well, the color. But
Yeah,
some people may not
that
tolerate
must
this.
hurt like hell.
No, it's a
Really?
very good topical anesthetic that they don't have not much pain. The topical anesthetic are very aggressive now these days. As far as a few minutes, we put the topicals and then it's ready for any treatment. Few minutes, 5 minutes. For most
Okay,
treatment.
so let's continue. So with permanent makeup, I can understand.
Permanent makeup for not everybody. Some people they require it. I spoke about the hyperpigmentation with CO2. As far as losing volume with the macroneedling and two different macroneedling that they do with longer needle and shorter needle that we use. Also usage of radio frequency and also ultrasound for weight loss.
Oh, that's it. Wait, that's interesting.
That's very effective. But the only thing there is
tell us more. What?
restriction for some people that who have, heart problems or any heart problems, or people with thyroid, we cannot use that machine.
So I need to know. Like really, I think everybody wants to. We just heard you say
It's
something
very
unbelievable.
effective. We have
How does
used.
it work?
We have done promotion on that
Wow.
treatment for so many, maybe 1,000, over 1,500 people have used that machine, and they've
So
been
how
happy
does it
with it.
work?
It's just with
Substrate your
ultrasound,
appetite?
with ultrasound and radio frequency. With radio frequency, you actually facilitate the lymph drainage, and with ultrasound, you melt the fat.
Wow.
And you do this every week, once a week,
For how long?
and for
Or
6 to 8 sessions.
Really?
Like as
I'm
far as
coming
the
to see her
as far
about
as the lower level of the
Oh, you mean so for us that anybody that has a little bit extra fat here?
with the radio frequency we can use upper body,
Wow.
but the ultrasound we cannot use the upper body. We can only use the lower body, the ultrasound and the radio frequency. It's very effective. Tightening and everything. Within 1 week, basically, you can almost lose
Look
5
like a
to
new
10
person.
centimeters.
Wow, this is great.
You're
I'll see you. We'll talk about this some more in another show. This is really interesting.
and
Amazing.
we also do, of course, Botox and filler. I wanted to talk. Lots of people are like they're resistant or they are hesitant to do fillers or Botox. I don't blame them because some of the people that who come to our clinic for doing fillers have done other clinics so much that it looks ridiculous to me. I wouldn't recommend that kind of.
I'll tell you, you talk about Botox, and I can tell you from experience that I know Botox is used for many different things because really my son has a bad problem with his back that
Yes.
that became from a sport injury, and the best thing that worked for him, he's getting actually Botox injection in his back.
Yes, yes.
And that's is a miracle for him.
Sometimes
to
I
have
have
worked,
pain myself in
and
my
it's
back,
like
and I
he
get
got
it
it for a number of months, and it's like amazing how much better he feels. So I was really surprised that when he started to get in Botox in his back.
And also, Botox is amazing for people that who sweat a lot. People that who sweat a lot in an embarrassing way.
Right, when their hands are sweat and
They get
okay.
on underarm
Yeah.
injection of Botox and the
Really?
sweating stops. After 3 to 4 sessions, basically the sweat doesn't come anymore. The glands learn not to sweat so much.
Because really what the Botox does, it freezes the muscle.
Yeah, the function of the glands that causes the sweat glands, basically.
Okay, so so if you do it in the back, it freezes the muscle.
It
And you
freezes.
do it so if we do it in the face, doesn't it do the same function?
Well, with Botox, we do very much lower dosage for facial,
Okay.
for cosmetic purposes. We actually, I believe the less you use, the better it is. I have the policy of less use, better result with Botox, because some people after a while they become immune to it. They don't respond. Some people have too much respond. After a while, even as far as one session, they can have too much response. So we start like from a very low dosage, and progressively we increase a little bit if they need it. If they don't need it, we keep it at a low dosage, which is very good. It costs a lot less at our clinic, and it's more effective. And everybody who comes, they love doing the Botox
So I'm
because
always confused. And what is the difference between Botox and fillers?
Botox is used to manipulate certain muscle to lift or certain muscle to relax.
Okay.
As well, we sometimes use it for contouring of the face, like especially these muscles on the jawline, and as well as, for people who are clenching their teeth at nighttime. We have a lot of people that, as far as they do Botox, lots of Chinese, they do Botox. They like to do this area for losing, contouring the face, but at the same time, some people use this area for not grinding their teeth
grinding it
overnight.
at night. Okay. So what's the difference between the Botox and the fillers? So basically
Botox we use,
different places,
certain
places in the
areas
face.
of the face we definitely don't use Botox because of the fear of.
Got you.
So people can have funny laugh or they look like
they'll stay frozen.
And there was one incident with a client of ours that went to another clinic, and she came to our clinic wanting to sort of correct it, that we couldn't do anything for her until it wears off, unfortunately. And every time that she laughed, she looked or smiled a little bit, she looked like she was in so much pain. So what we did was actually, my staff, like me and the nurse, laughed so much, and then and everybody said, laugh, laugh, laugh. We wanted to see how it looks. Obviously, we don't. I mean, it's not.
How dangerous is it if somebody gives you, too much Botox? Let's say. What's the danger?
It can paralyze you. Basically, there was a case that. Couple got a doctor in the U.S. I don't know, for 4 or 5 years ago. They used the type of Botox that they were giving to veterinarians for horses or for cows. 50,000 times. The mixing was a lot more potent than they figured out, so they used that for a couple, and those couple stayed in hospital for a year because they were paralyzed. That's what's.
Wow.
But in our clinic, we get like 100 units of Botox, Allergan, or Dysport, and it's calculated properly. And fortunately, these products are very controlled and very properly measured and tested, and it doesn't do that.
Do you believe that if a woman wants to look great, she should, doesn't have to do surgery?
I don't believe surgery.
You don't believe in surgery. There's a lot of other ways. Do you ever believe just in cream? I mean, there's so many, creams out there that they're saying this cream does a miracle. This, makes you look wonderful. What do you say about that?
I believe the moisturizers, some of the moisturizers that are in the market, especially the medical grade like retinol and macro exfoliating creams, are fabulous with alpha-hydroxy acid. It's very, very important to use in order to prevent forming the lines, in order for getting rid of the hyperpigmentation, melasma, or whatever. Even though retinol itself, if you use too much and to go in the sun, under the sun, you may get hyperpigmentation from it. It's one of the side effects of retinol. But if it's used in a proper manner, it's definitely not going to cause any problem. So Botox, we were talking about Botox. How Botox in lifting around the eyes is fabulous because sometimes people cannot use Botox above the forehead because it droops. But once they use properly around the eyes, it gives them a lift, for sure. So, and it's very, very, the best treatment using the Botox around the eyes. But it has to be with someone
Somebody
very
really knows what
professional.
they're doing, yes.
Yes, exactly. Otherwise, you could
I'd be terrified,
you
yes.
could have closed eyes and it
Yes.
couldn't, or open eyes, or. Anyways, as far as fillers, the same way we can. Like I personally do. I have a doctor who works with me. I work with a doctor as well in my clinic, and we have a team of professionals working with me. And I usually, if somebody doesn't need anything, we just praise them and say, no, you don't need anything. Maybe you
look
could use
beautiful
something
as
for
you
your
are.
skin.
Yeah.
And we actually, so many clients who come in our clinic on weekly basis, we deter them not to do anything because they don't need it.
Okay, fair enough.
Especially a lot of young age people that who come to our clinic, a lot of times they want to do all kinds of things. They're excited, they want to do, and they have all kinds of money. They save to do this. And it's very easy to convince them to do this, this, this. And I, with my conscience, I would never use that to, for a 25 years old, I do cheeks unless they are absolutely sunken in or they have deformity or they want to do their lips this much. I would never do anything. I may touch up a little bit to do their fillers in the lips, very small, and then gradually, if they're happy, we keep it at that. But I won't cross the limit that I think it should be appropriate for the look of the person. And I like to encourage everybody to come in. You may think that it's going to be costing you a lot, but it won't cost you a lot. It is realistic prices. You'll be surprised how good service you get, and you'll be surprised how less you pay, how much less you pay than.
Oh, you're so wonderful. Places. You really are wonderful. I mean, she really is wonderful. She does it. She comes here to, you always come here to explain to us.
Thank you. You're wonderful.
No, it's to, I think everybody should know. I think everybody should do whatever they need to do for themselves. And I asked you about the cream because I've said it on TV. I've started to use it, and I see a difference. It's a serum. It's from the company called Secret. And it's just a serum, but it's like, I think some kind of an oil, a serum oil that I just put on my face instead of moisturizer.
You're happy with it. If you're happy with something, it's fine. But
it seems like, people stop me and they're like, what have you doing? And then really, I'm not doing anything.
No, but there's several different products that are in the market.
But I've heard many people.
You may not, I mean, they may cost a lot for you. They may cost, the product that I work with, it costs the minimum, but it does the maximum work. And that's how I work. I used to carry 600 jar creams that it wasn't realistic. We couldn't sell more than two a month.
Yeah, because, really...
People can't afford it.
You can't afford it. Most people can't afford
So
it.
the product we carry is like $60, but it does like 3-4 months, and it works a miracle.
Reasonable. Michelle, I really advise everybody, just go see Michelle. Just go see. And we love her. She always comes and helps us and gives us all the latest information. And maybe next time...
If they have any question or anything, they can actually...
Yes, please either send me an email or go see Michelle. I guarantee you she'll explain to you, be patient, and help you out. And make you look beautiful if you need to. Michelle, thank you so much for being here again.
Thank you so much for asking.
And I thank you very much for joining us this week. And I'll say goodbye, and I will see you next week.